and I want to talk about flu infection. Flu infection. Flu infection is an acute respiratory illness caused by influenza A or influenza B. It's usually in winter season and always associated with an outbreak. It's epidemic and can occur anywhere in the world, so it is worldwide. How is it transmitted? Transmission is via sneezing, coughing, droplets, or aerosol during breathing. Contact with surfaces contaminated with droplets is a great means, and mostly through respiratory tract. There's possibility of transocular entry, and incubation period is between 1 to 4 days. Shedding of the virus starts 24 to 48 hours before the onset of the illness. In other words, if you think you want to run away from anyone already exhibiting the signs and symptoms, well, that's fine, but you might have contracted it 24 to 48 hours before noticing the symptoms. So you can see how horrible the transmission could be. 24 to 48 hours before the onset of signs and symptoms, transmission had already occurred because the shedding had started before then. Children can be shedding the virus for a longer period of time. That might account for the reason why little kids in daycare, preschool, and school age groups could easily spread it more than other people. Also, elderly and sick people, obese, and everyone with decreased immunity can also shed the virus for a longer period of time. Decreased immune people shed for about 19 days, but immunocompetent people will shed it for about 6 days. So if you have someone that is on chemotherapy around you, or with diabetes mellitus, or HIV, or anything that draws immunity, and the individual is now infected with influenza A or influenza B, well, you have to take extra precaution because for a longer period of time, the individual could be shedding it. Oseltamivir, commonly called Tamiflu, decreases shedding time and increases clearance. I will have separate presentation on Oseltamivir or Tamiflu, as the trade name is, in a bit. Lymphopenia. There will be increased shedding time when there is lymphopenia in all patients with lymphopenia, either immunocompetent or immunocompetent. What are the possible clinical features of flu? Well, one good thing about flu infection is that it is self-limiting. In other words, even if you don't take any medication, with good immunity, it's likely you might get out of it. But there's no guarantee because flu infection has claimed many lives. But it is still self-limiting. There's possibility of it occurring very suddenly, that is sudden onset, associated with fever, headache, and body pain called myalgia, malaise, cough, and sore throat. So when you have all this, that will distinguish it from common cold, okay? When the onset is sudden. In fact, some people will be able to describe exactly the time that flu infection started in them. I mean, the time they started experiencing the symptoms. So it's likely going to be sudden, maybe just immediately I returned from school, or immediately I returned from work, or immediately I woke up, then I started. So it's going to be so specific that some will be able to know the exact time, even few hours that the onset started. To be associated with fever, I've said, headache, generalized body pain or myalgia, feeling sick, malaise, the coughing with sore throat. Also associated with nasal discharge, sneezing, can be afebrile. So it's not everybody that will have fever, particularly the immunocompromised and elderly may not exhibit fever. So when you take your temperature with thermometer and it's not reading high level, don't think I'm not sick. Maybe. And features of common cold, anorexia, weakness, and dizziness. There are special clinical features. The fever will be very high, could be as high as 91 to 41 degrees Celsius, particularly in children. And elderly may not have fever, just as I've said a while ago. They may not have the sore throat, they may not have the myalgia. So the presentation may be atypical in elderly. That is why when I made my presentation on eye flu dose zone, I have told everybody that please take the grandpa and grandma to get that very high dose of the flu vaccine because they really need it. We might not be able to say that truly they are down with flu infection because it may be atypical in them. On physical examination, the individual could appear hot and flushed with hyperemic pharynx, and when you check the cervical region for lymphadenopathy, for sure, you're going to get some sometimes. And when you do chest auscultation, it's likely going to be clear, except when it is already complicated with pneumonia. Okay, you still do laboratory investigation. Yeah, when you have your white blood counts from complete blood count, it's going to be high, about 15,000 cells per microliter. And if that is the case, it means there is secondary bacterial superinfection. Okay, when the white blood cell count is very high, and this is flu or the flu season, it's likely we are dealing with secondary bacterial superinfection. I'll talk more about that when dealing with complications of flu infection. Okay, when you take nasopharyngeal swab, then you'll be able to deal with the virus through polymerase chain reaction, as PCR, or you do ELISA, that is enzyme-linked immunosorbent assay, or you can do what is called direct and indirect immunofluorescence. You can have viral culture, complement visitation, or rapid molecular assay. The progression is such that the situation will improve gradually within 5 to 7 days, but that's not guaranteed. It could be longer. Post-influenza asthenia, that is persistent weakness and easy fatigability for several weeks, is possible. Let me explain that further. After the individual is done with signs and symptoms of flu, then there's possibility of post-influenza asthenia. In other words, the person can become very weak and having fatigability for several weeks. So don't be mad at your staff or colleagues, your children, when you think, oh, it's more than a week, they should be out of it, but the individual is still weak and getting tired easily. That is post-influenza asthenia. Okay, for now, I'll end this by saying that host immune status or comorbidity will determine the severity. In other words, it is going to be severe in some and not in others. And note this, the type of influenza strain in circulation is a big factor to determine the severity. There was a time it was H1N1. It depends on the strain in circulation. Then there was a year that the particular age group that were dying were actually younger people, and most of the times the people dying secondary to flu infection were immunocompromised people. But it depends on the strain in circulation. So you can tune into your TV, to your radio, or online information and checking my channel in future to know the type of strain that is in circulation for that year. So with that, I've come to the end of flu infection, and the next presentation will be on treatment. Kindly subscribe to my channel so that you can get these presentations immediately they are published. Thank you.